Good morning, Dr. Nunez Smith. Thank you so much for joining Be Latina News today to talk about such an important topic, COVID-19. So first of all, I want to introduce you to the Be Latina audience. Would you mind telling us a little bit about yourself, please?
Absolutely. And it's just great to be here and with you and with all of you really in conversation. Um, so I'm a practicing internal medicine physician. I'm based at Yale University in Connecticut. But it's been just my deepest honor really to be working as part of this administration. And I serve as a senior advisor to the White House COVID-19 response team. But I'm also chair of a health equity task force that the president signed into being on his first full day in office. And, just equity, health equity, thinking about our communities of color is at the core, has always been for the president, the vice president. It's the tone across the entire administration. So I'm really pleased to be with you today. I know we got to talk about the important topic of COVID-19.
Absolutely. And thank you so much for bringing your expertise. It's something that, we all need, especially the Latinx community. So being that COVID-19 is so important, we want to talk about how to gain trust, right? A lot of people in the Latinx community, Latino, Latina community, they're still a little hesitant. So I want to know, what is that one vital piece of information that we can give them that would gain their trust when pertaining the vaccine?
Yeah, absolutely. So we are really fortunate, actually, here in the United States to have COVID-19 vaccines that are safe and that work, that are effective. And I want to talk more about that, but also to let everybody know that from very early on in his administration, President Biden made sure we had enough supply for everyone who lives in our country to be able to get vaccinated. And now we have vaccine available for everybody 12 and older. But I spend a lot of my time in conversation with people who are still deliberating, right, about vaccine. And I understand that. The first principle is, we're going to respect that. We're going to respect that people have questions, that people need more information. And importantly, that people need information from people that they trust. And so part of our conversation today, I want to bring accurate information. There's so much misinformation and disinformation that is targeted directly at our communities by really bad actors. I think that's just a tragedy. We have to counter that. But I'm going to be one of many voices. I'm so grateful to all of the faith leaders, to all the community leaders, to all of the providers, right? All the clinicians, the healthcare workers who are out there in their families, in their neighborhoods, getting that information out. But let me just bust a couple myths really quickly, right? So one, people think these vaccines were made too quickly, right? And so that's the first thing, is that the vaccines are all built on over 2 decades. That's 2 decades, right? 20 plus years of scientists working at this. And what we saw, is as we were struck by that global pandemic, all resources were brought to bear to be able to accelerate that process, but no steps were skipped at all in the vaccine process. So important to know that. And at this point, we're really grateful. We have over half of our country fully vaccinated. That's really important. The president is pushing us to get to 70% by the 4th of July. It's a really important target, but it's uneven. And we know that in our communities, we got to do more. And vaccine has to be easy and convenient. So that's super important. But let me just tell you, they work, and their safety profile is great.
Thank you so much for that information. And yes, it is so vital that we continue hearing this information from experts and not those who are trying to, inject their own perception of the truth. So the work that you're doing is so crucial, especially to our communities who are often excluded. Because it is how things have been set up for so long. That's why these conversations are what matter right now. And now I know that you spoke about the effectiveness of the vaccinations, and thank you so much for that. But now, another thing that I suppose worries a lot of people in the Latinx community is having their personal information used aside from the vaccination records. What would you say to them?
Yeah, let me tell you, I'm so glad you asked that question. There is no data sharing. All right. So the data are held private. That vaccination data is not going to go anywhere else at all. Let me also say this. So vaccines are free. So no one should be charged 1 penny to get vaccinated in the United States, right? The vaccine itself is free. If you don't have insurance, then the federal government will cover the cost of administering the vaccine. So there's no out-of-pocket cost. Listen, you don't need any government issued ID to be able to get vaccinated. Really important. So no documentation necessary. You know, I get asked that all the time about citizenship or not. No, if you are here, we want you vaccinated. We want you safe. We want your family safe. We want everyone here safe. That's what vaccination gets us. So really, really critical information there about what you need and don't need in order to get vaccinated. And the data are kept private.
Thank you so much. And I asked that as well because when I was creating my own appointments, and I was doing it for my mom. So my mom wasn't able to do it on the computer because, it was difficult for her. It's like, don't worry, I'll do it for you, for your friends, for everyone. I'm going to be the person to go to. Now, there was that question on, do you have proof of insurance? And we are insured, but my mom asked me, and I was like, "Mommy, it's okay." But then her friends, and I'm like, "It's like a plain telephone." I'm like,
Yeah.
"Okay, Mommy, this is what it is, but make sure you get the accurate information to your friend at the next friend." But I want our audience to also understand when they get that question in their COVID-19 appointment maker, proof of insurance, should they worry?
Yes, perfect question. So do not worry. You do not need insurance to get vaccinated. Let me tell you a little bit about that question. And it's hard and some systems differ, but if you're encountering a system that's asking about proof of insurance, this is about the cost of administering the vaccination, right? The vaccine itself is free. The federal government has already paid for that, right? But then for somebody to actually administer the shot, there are costs for that. So if you have insurance, then they would bill the insurance company for those administration costs. If you don't have insurance, they bill the federal government for those costs. So it's just a simple yes, no. It's not a stop. It doesn't in any way keep you from getting vaccinated. And so, it's so unfortunate because I hear about this so often. So grateful for this chance to say, you do not need insurance. You do not need proof of insurance. You can answer no to that question, keep moving forward, and still get vaccinated.
Thank you so much, Dr. Nunez Smith. And then I do want to open now the space for you to say anything else, pertaining to the COVID-19 and to the COVID month of action. Are there any final words that you would like to add?
Yeah, thank you so much. There are two things that I want to hit on. One is, really to talk about the ease and convenience of getting vaccinated. And the second is to talk about reasons to do it and reasons to do it now. So on the first front, we've been talking a little bit today about some of those logistics. Really important for people to know that if you text either get vax, GETVAX, right, or vacuna, VACUNA, right? If you text your zip code to either of those numbers, get vax, you'll get the information back in English. Vacuna, you'll get it back in Spanish. It'll give you the 3 nearest locations that have vaccine available. But importantly, they'll also ask whether you need transportation to get there, and will provide transportation if you need it at no cost. And if you need childcare, that's really important. A lot of us, I'm a parent, I have 3 young children. So if you need your children to get watched so you can go get vaccinated, or if you have to, recover from any of the mild side effects, there's also free childcare available. So I want everybody to know that, right? So you can text your zip code to those numbers, get vax or vacuna, get the information about the locations of vaccination, but also if you need childcare, transportation help, the government will provide that, no cost, again, no data sharing, so important. Now, there are over 20,000 pharmacies in the country that do not require appointments. It was hard to navigate the registration system, no question. But now you can walk into your local pharmacy and just get vaccinated. So really important too to keep in mind that it's easier now than it ever has been. Now, the second thing that I want to speak to, let me just say one more thing about people sort of connect with vaccination. I hear a lot about not being able to miss work. That's so important. So President Biden has made sure that there's paid time off for everybody working in small, medium-sized businesses. That's less than 500 employees. And really, most large employers have stepped up to offer that. So the majority of people in the country really can get paid time off to get vaccinated, but also if you need a day or two because you have body aches, fatigue, low fever, the things that we know are fairly common. That doesn't happen to everybody, but certainly if you need a day or two to recuperate, you can get that paid time off. So really important.
Awesome.
The second thing, if we have a moment, is I just want to talk to people about kind of the reasons why. You know, a lot of people say either they think they had COVID or they're certain they had COVID or they're not worried about it. But things have changed a little bit. We've been watching these variants, right? So the vaccines can change and mutate. And some of those mutations are worrisome. We have in the country now the Delta variant. Folks will be hearing about that, I'm sure, on your news. The Delta variant is very serious. We see in the United Kingdom, it's quickly taken over as the most dominant strain. It's more contagious, passes more easily person to person, and it also can produce more serious illness. And we're seeing it affect younger people, right? So even our adolescents and our young adults, and they're ending up in the hospital and worse. So we want to make sure we get ahead of this variant. The vaccines that we have protect us. Those who've been vaccinated, both shots with the mRNA vaccine, both shots are important to get that full protection against any of the variants, particularly, of course, against Delta, which we know is here in the United States and in circulation. So one other reason, you know, the other is people are really struggling with these long COVID symptoms. Just months afterwards, debilitating. You know, doctors were all trying to understand how best to treat it. But the best thing is to avoid it in the first place, which means avoid getting infected with COVID. So just to add to our list of reasons now, protect yourself against the variants, protect yourself against long COVID. And together we're hopeful. This is a really hopeful moment. We're looking at July 4th, really hopeful moment, but we all have to get there together.
Absolutely.
Go out, get vaccinated.
Again, thank you so much, Dr. Nunez Smith. The information that you've provided me and provided the Be Latina audience and anyone beyond the Be Latina audience, meaning the Latinx community, the BIPOC community, all these people who are usually, they're usually underreported. This is so important. So thank you so much. And I hope that, everyone goes out and gets their vaccine. I know I did, got my vaccine, all my family members. And so the vaccination is so important.
Yes. Thank you so much. Thank you for all you're doing. Please be well.
You as well. Thank you so much.